This is the DocNation podcast. We are a movement founded by doctors, for doctors, dedicated to empowering medical professionals to reclaim control over healthcare decisions and advocating for their fair share of the industry's resources. Please note, the views expressed are those of DocNation and not necessarily those of our guests or referenced health centers.
Dr. Sheldon, would you mind introducing yourself, please?
Yeah, I'm Sheldon Taub. I'm a gastroenterologist in practice since 1979, but I can give you, I'll give you the finer details in a few minutes. And I practice in the East Coast of Florida in Palm Beach County.
Okay.
Great location.
Yeah, except when it's hurricane.
Yeah, that's right.
And
Sheldon, you were just telling us a moment ago. Keep going.
Okay. Anyhow, as I was saying to Justin, how I have the advantage over all you guys of being old. I guess it's an advantage, but being old and knowing medicine. When I started out, as I was saying to him, in medical school, they don't teach you the business aspect of medicine. They teach you how to diagnose and treat patients, but they don't teach you how to manage a practice. Chiropractic school, they teach you that. And in dental school, they actually have business courses. In medical school, they don't. So when I started in 1979, it was almost embarrassing because I didn't know the first thing about how to start a practice. So what did I do? I didn't even know what to charge patients. So I had my wife and my mother call doctors' offices, my competitors, and say, oh, I need this, I need that. Was the doctor? And that's how I formulated my thesis early.
Yeah, good research.
And then what I found out was, again, this is 1979. You could almost, if you worked hard, you made a great living. Mm-hmm. And you kind of had to tweak it. You'd have to tweak your practice every once in a while. You had to negotiate for contracts, but the only way you negotiated for contracts then, you didn't try to undersell somebody. You said, I'll be available. Mm-hmm. So it wasn't like, well, Joe Jones down the street charges $49. If I charge $45, I'll get more. No, what I would say to insurance companies then is, if you have patients, if your carrier has patients that I participate with, mm-hmm. They can call me. They can call mm-hmm. me weekends, nights, holidays. I'll make sure responsive. And that's how you started a practice. And I grew that practice to a 2-man, then a 3-man, then a 5-man, then a 6-man practice. So up until the late 90s, we had 6 gastroenterologists in North Palm Beach County. Now, that doesn't mean much to you guys, but when we moved to North Palm Beach County in 1979, my wife cried because across the street from the hospital I was at was a farm. And she's from Michigan, I'm from Ohio. And she said, you're taking me out to the country. I don't want to practice in the country. and now, if you saw what North Palm Beach County looks like, it's it's jammed. So we really had the benefit of starting in an area that wasn't crowded. And we built a practice. I had a great practice. And I can't complain. Then what happened is, in the 90s, managed care came into effect, HMOs. And HMOs, I think, were the beginning of the end for doctors. You may or may not agree, but...
no, say more about that.
Tell us what you think about it.
Well, what do I mean? I mean that it was a numbers game. It was a numbers game with patients, and it was a numbers game with billing patients. And somebody would come in and say, well, we'll give you our Blue Cross contract. And you can see you'll sign up with us and you can have our Blue Cross patients if they come to see you. Versus if they don't have Blue Cross, they'd have to pay out of pocket. And we say, fine, we'll do that. And just like everything else, for the year, they were great. Then the second year, when they would come to negotiate the contract, they said, well, you have 300 Blue Cross patients. We're going to cut back by 10%. All right, you can cut back by 10%. We're still doing well. We're still taking care of your patients. 2 years later, negotiate the contract. Well, times have changed, and we've started an HMO now. So rather than pay you a fee for service, we're going to pay you a flat amount, and you're going to take care of our patients whenever they call. And if you don't see anybody, that's great. If you see a lot of people, you take a hit. And we had to deal with that in the 90s. And that was tough. And then we also had problems too. And I'm not going to badmouth any of the insurance companies, but we had a problem with getting paid. In other words, I had to hire a healthcare attorney because one of the companies went 8 months without sending us a payment.
Jeez.
Now, if you
How
know,
can you operate a business if you don't get paid for 8 months?
Exactly. And so we're kind of robbing Peter to pay Paul. We always had
Absolutely.
Medicare, and Medicare was always reimbursing reasonably, but the private insurance companies were always kind of a hassle. They were always kind of a hassle. So that's in the late 80s, early 90s when I decided if I don't speak up for myself and for my fellow doctors, nobody's going to. So I started getting involved locally in politics. I became chief of medicine at both hospitals. Became chief of staff at the hospital, and finally worked my way up to the president of the board of trustees at the hospital. And did it have any influence? I think it had some influence in healthcare. It certainly didn't have influence in the reimbursement, but it had an influence in how I could implement healthcare to my patients. And then I kind of segued that into state politics. I got involved with Florida Gastrointestinal Society. I was president of that. And we had more, now we're talking about a state society versus, North Palm Beach County.
Sure.
We really had some clout in dealing with insurance companies. Because if you've got 600 gastroenterologists who are part of the society of the state of Florida, and they have, say, 14,000, 15,000 patients, you can carry some weight with the insurance companies, where you couldn't if you had 50 patients or 100 patients. And then it kind of segued into national. I got involved with the American College of Gastroenterology, and I was governor for the state of Florida, and I was on several national committees. And the bottom line is that if the squeaky wheel gets oiled, if you don't speak up, nothing happens.
Right.
Even if you speak up, not a lot happens, but at least you're being heard. And if you keep, my kids say I drive them crazy because I keep saying the same thing over and over again.
You have to.
But you got to do it. You got.
I love what you said about that, because the squeaky wheel. What if every doctor was a squeaky wheel that didn't stop squeaking, and they just continued to be squeaky nonstop every week, every month? They would be so loud, there would not be a way to silence it. It would be impossible. And you said on a quote recently that the biggest threat to physicians right now is losing autonomy and decision-making. In spite of extensive training, they are told by non-medical personnel how to manage patients. And that just, I think, echoes with everybody who's tuning in.
It drives me crazy. Now I'm only working part-time now versus full-time. And I'm working totally on my terms.
Good for you.
I'm not going to the hospital. I'm not taking night call, but I still, when I see a patient, I sit down, I give them eye-to-eye contact. I don't have a computer in the room and my back to them.
Someone else said that recently.
I can't do that. Again, I'm old school. I was taught way back when, before you guys were all born, that if you talk to a patient long enough, they'll give you the diagnosis. But
That's good.
You have to give them the time, and people don't want to do that. And I still call my patients. I call my patients with their lab results, with their CAT scan reports or MRI reports. Why do I do that? Partly out of my own OCD. in that if I do it, I know it gets done, number one.
Mhm.
Number two, it cuts out the middleman. Who's the middleman? My medical assistant. If I say, okay, Carol, call so-and-so and say their CAT scan's okay. She calls and says, hi, your CAT scan's okay. Now what do I do? So she comes into me and says, now what does he do? Tell him to do this. Okay, what? It just was much easier for me to be one-stop shopping. I did
Mhm.
it, I do it. Does it take more time? Yeah. Do I get reimbursed for that time? Definitely not. Am I pissed off about that? Definitely. But that makes me sleep better at night. So,
Can you imagine getting a call from your doctor with lab results? That's never happened to me in my life.
well, let me tell you something. I get that all my patients who've been my patients for a long time accept it and are aware of it and appreciate it.
Mhm.
And I tell patients when I see them, I will call you with a report. And when I call them at 6 o'clock at night or 5:30 at night with what do you call me about? I said, remember I said I would call you. Everything's okay, but I just want you to know your lab came back fine. There's not a problem. The occasional patient will get ticked off and, why are you calling me on a Saturday morning? Well, because the report
Mhm.
came in Friday night, that kind of thing. So,
I love what you said about how patients, if you talk to them long enough, they give you the diagnosis. Like that is, and you said that you have an advantage over us with your experience. And that's the truth. You have more experience. You are more socially connected. You likely have done some made some smart decisions along the way financially. Like you're at the prime of your life to have the most to give. You're a wealth of information and knowledge. The wisdom that you have is right there. And it's like our system has gone so far off track that it can't even remember the fact that the patient has the diagnosis on their lips. You just need to get it. You just need to just take it off of their lips. They have it waiting for you.
let them talk, let them ask them some really pertinent questions, and they'll tell you what's going on. And if you spend enough time with them too, you can kind of separate the wheat from the chaff. You can decide, is this important versus is this important? That kind of thing. It's true. It's really true. Um, yeah.
What if every patient or every doctor had the ability to not have all the middlemen, all these different pieces? You got to have the time and you didn't have to share in the revenue with a bunch of other hands in the cookie jar. What if you and your team, you got to manage that yourself? What if every doctor could go back 40 plus years ago to what it used to be and actually be able to have that relationship with their patient? We're in the worst shape as a nation, health wise, than we've ever been.
I mean, I just read something the other day. I'm sure you read it. That they rated the 10 top healthcare systems in the world.
Mm-hmm.
It was like Norway, Switzerland, Germany, all those. We're number 10 in the top 10 in administering healthcare. That's sad.
That's sad.
That is,
Somehow we're number one in the world, or we used to be in lots of respects. And now we're at the bottom of the 10
yeah,
as
yeah,
a nation.
yeah.
We could easily be number one.
Oh, there's no question about that. I'm reading something this morning while I was getting ready for this.
Yeah.
This is the headlines in today's newspaper business section. Quote, companies expect 6% bump in healthcare next year, end of quote. Certainly that 6% isn't going in my pocket.
No.
So you were talking about the middleman. You got these PBMs. You're familiar with PBMs?
Mm-hmm.
I'm on the Florida GI board and Florida GI Board of Directors, and we voted to outlaw in GI PBMs as much as we can. I don't know how effective that's going to be, but that's a middleman who comes in. He's making 10 to 20% on the amount of money between what the manufacturer makes for a drug and what the patient pays. That's ridiculous.
The entire healthcare field with the people who actually see patients is built off of goodwill and trust, right? And it's like all that goodwill and the intentions of all of these practitioners, while they go out and do this work little by little, it's just been extracting, exploiting. It's just been nothing but exploiting nonstop with the example that you're talking about. So, Sheldon, what would you say are some things that could be done? What direction do you want to see healthcare go with regard to the shift? I mean, this has been a 40-year erosion of quality, erosion of value and in control for doctors. What do you see as the way to turn this around?
Okay. Well, I was writing down a couple of things, getting ready for this. And, you know, in every business, the bottom line is always money. You guys know that? I know that. You know, you can, I mean, I volunteer, I give my services, I don't get paid for it. That's a small percentage. I wouldn't do that if I couldn't afford to do that.
Sure.
So it's always about money. Medicare has cut back 22% on doctor reimbursement since 2002. Now, that means what other profession has had a cutback like that? So I think, you know, you had mentioned earlier on unionizing.
Yep.
But I think doctors are afraid to do that. I really do. Because the term union comes into the layperson's mind. Oh, it's like the Teamsters and throwing bricks and carrying pickets and blocking people from going in. That's not unionizing. You can unionize it in a way that will support physicians, but it has to be tactfully done. I think that's one of the things.
Yeah. Number
two, I think physicians need to be more involved in their rules and regulations. They really do. Like we were talking about, you said I made a comment getting a reimbursement for or authorization for a procedure. It's embarrassing to my integrity that I should be talking to a retired gynecologist in Tuscaloosa, Alabama, about a CAT scan.
Yeah.
And he's looking at a chart that my 10-year-old grandson can look at and say, you need to go from A to B, Poppy. No, you don't go from A to B, because A to B doesn't always make sense. Sometimes you can go from A to D, and you can cut out a lot of extraneous costs. But it just, that whole thing is just wrong. It really is.
So how do they get involved? So what can they do, though, if people that are listening in, what can they do to get more involved in the rulemaking? Because that's really what you're saying.
What can you do? I got to speak up. You got to speak up. You have to be willing to put that extra time into your life, your livelihood, into what you do to have an effect. Any effect is better than no effect. So if a bunch of people get involved and they seem to influence other people, I mean, you have to have your people in your area that have some influence too. You take a guy who really is not a person, I got to be careful about saying a guy. You take a person in your area who's not well respected or well known, and he starts shaking the cage, nobody's going to listen. But if you take somebody who has some authority in your area and he starts speaking, other people will start listening. I think. You know, and DocNation is the way to go with some of that too. I think, again, I told you earlier, I think if you have to get your, I mean, I read about you and I read these sites, and I'll mention to some people, and people don't do it. I don't know how to get that information out any better.
Yeah, well, you're right. The word needs to get out. Doctors need to have the confidence to come together. To be able to
no matter where you're at in the nation, if you see DocNation, or Shell, if you want to send this out to people, send us an email. We'll set up a meeting, and no matter where you're at in the nation, we will teach you and show you how to get your voice heard. So we'll build a plan with you and for you, no matter where you're at in the country.
I think that's critical. Again, I'm rounding third. I'm on my way home here, and my involvement is getting to be less and less. But I deal with. I'm practicing now with. It's kind of sad. I got to be careful what I say. But I'm practicing with guys now, or people now, that they just want to come in, get paid and leave. And that's sad to me.
You're saying you find that there are doctors that aren't necessarily as
They're there
it's
for
like
the paycheck.
They're there for the paycheck.
just the culture, the generation that we're in. I mean, we're seeing
Yeah.
that not just in healthcare, it's across the board, but yeah, the care and
Yeah,
concern.
but Justin, healthcare is different though. Remember, I share this. You know, we're sitting there eating dinner, and we see our family doctor, and my dad makes sure to pay for his dinner. There's a different level of reverence that physicians should have. What they go through to become a physician is different than 99% of professions out there.
Yeah.
So physicians ought to not just be there for a paycheck.
I agree. I'm 100%.
But the deterrent, I'm sorry to interrupt, but the deterrent for a physician to be there for other than a paycheck is so large that it's tough to blame a physician for that.
No, the average doc starts off with $240,000 in debt. I mean, that's crazy. I mean, I remember going to my 15-year high school reunion. Now, 15 years, I just finished my residency, my fellowship. I was getting ready to start practice. I think it was maybe 6 months in my practice. And I'm talking to guys, again, this is back in the 70s. I'm talking to guys, and they say, well, how you doing? I said, well, I just started out. I'll probably make $60,000 this year. These guys are making $150,000. They've been doing it for 5-6 years before me. And you say, whoa. But you can't do anything just for the money. And that's a problem. Because if you go into medicine just for the money, you're missing out. You're missing out. To me, this was one of the questions I think Betsy asked me is, well, what was my incentive to go into it? Well, I had a little bit of a background because my father was a pharmacist, so he was exposed to physicians. But for some reason, I thought, God, it'd be kind of neat to get somebody better, to make them better, to make them say thank you.
Oh, yeah.
Yeah. And so and I was always good in sciences, always good in math. So that was a no-brainer. Then I could do that. I applied to business school, and I got into business school, and I said, but I don't want to do that. People may say thank you for making the money, but you can't. When you say thank you for getting me better, that's the best.
That's powerful.
It is really powerful. I would have to imagine that most people that go through medical school and set up a plan to be a doctor probably feel the same way. But if having $240,000 of debt, you'd be focused on that a lot.
Oh yeah. Oh yeah. I think, now some of the states, I know Michigan and Florida are subsidizing, and maybe even paying the full boat for some people if they agree to go to certain areas in the state when they finish. And that's a decent idea. I think that's a decent idea. But I think the tuition, well, it's not just medicine. The tuition in college has gotten out of hand. It really has. It's crazy. It was expensive when I went, but now it's almost prohibitive. You can't be a underprivileged person and get into school without a scholarship. It's just not going to happen. So.
Well, we appreciate you coming on, Sheldon. This is why we exist, is to get a place to have people like you share what you've seen happen, and the track that we're on continues to go the wrong direction. You've watched it completely change. You said it was, I think earlier before we jumped on, about it's laughable how much different things are today compared to how they used to be. And for the young doctor who's starting now, like, I wasn't planning on sharing this, but I have a cardiologist right now that's like, I just finished fellowship. I'm starting my job right now. I don't want to be a cardiologist anymore.
Great.
How's that possible? 10 years and you're done being a cardiologist. You haven't even started. It makes no sense.
No.
So we exist to make it possible for you to have your voice heard, to rally the voices in your workplace, among your colleagues. Whatever you need help with, just reach out to us. We'll get you connected with all the people and the places, and we're a massive network. And that's what we're here for. So whatever we can do to support you, Sheldon, or your colleagues.
Great. I have a question for you. Again, I had mentioned a little while ago but I'm still on the Florida GI board, Gastrointestinal Board of Directors. We have bi-yearly meetings. Is there a way I can get you guys involved with one of those meetings?
Yes.
We would love to.
Yes, we'd love to.
Thank you.
Yeah, no, I would. And what they usually do, it's usually a between a 2 and 3 day meeting, 2.5, 3 day meeting. But if we can have you guys come in and just do some blurb on what you do, 20 minutes in front of 200, 250 GI docs.
Absolutely.
That I think that would mean a lot.
We would love to do that. That's why we exist.
Yeah, well, that's great to know.
Because one thing I don't like to get on here and do is say, hey, doctors, you make your voice heard. Most doctors are so focused. They're so stressed out. It's like, okay, what do you want me to do? Lay in bed and shout, hey, this sucks. No, reach out to DocNation. We'll help your voice be efficiently heard. And so, Sheldon, you just let us know when and where, and we'll be there, and we'll have at least 20 minutes worth of info. You got
it. Because the director, I talk with him regularly, and if he doesn't have the whole March meeting planned up already filled with slots, I'll let you know. Otherwise, it's either March or September.
Whenever it is, we'll make it work for us. Hey, Sheldon, thank you for making the decision whenever you made the decision to speak up and make your voice heard. You didn't need to be the chief of staff. You didn't need to do all those things. They probably weren't high paying, if paying at all. Yeah. So thank you for.
Now it's all being paid, but it wasn't when I did it. So.
Thank you for your servant leadership, and we appreciate that.
My pleasure.
Thanks for today too. Yeah.
You're welcome.
All right, Sheldon. Nice to meet you.
Nice talking to you.
All right. Bye-bye.
This has been the DocNation podcast. If you like what you heard, be sure to subscribe, rate, and leave us a review on Apple Podcasts, Spotify, or wherever you are listening to us. Your feedback really helps us reach more listeners like you. We'd also love to hear your thoughts and any topics you'd like us to cover in future episodes. Don't forget to follow us on Facebook, Instagram, and LinkedIn for updates, behind-the-scenes content, and to join the conversation. Thanks for listening.